You clear your throat, and 30 seconds later, you have to do it again. Sound familiar? There are actually over 15 completely different reasons this could be happening, and the scary part is, most people only ever check one or two. Stick with me for the next 35 minutes, because we're going through every single one. Picture this. You're sitting at dinner with friends, good food, good wine, good conversation, and then it happens. That feeling, that thick, uncomfortable something sitting at the back of your throat. You try to swallow it down quietly. You really do, but nope, it's not going anywhere. So you excuse yourself, you do the throat clear, you come back to the table, and now everyone's looking at you like you've got some kind of contagious plague. You smile it off. But inside you're thinking, why does this keep happening to me? If that scene felt way too familiar, you are absolutely not alone. This is one of those health issues that millions of people deal with every single day, and yet almost nobody talks about it openly. It's embarrassing, it's exhausting, it affects your confidence, your voice, your sleep, and most of the time people just quietly suffer through it, assuming it's just what happens when you get older. It is not just what happens when you get older, and today we're going to prove that. Here's what we're doing in this video. There are over 15 completely distinct causes of chronic throat mucus, and I mean genuinely different, coming from completely different parts of your body, requiring completely different solutions. Today we go through all of them, every single one. I've organized them into 6 groups so it's easy to follow, and by the end of this video you'll know exactly which category your situation likely falls into and what you can actually do about it. Now, quick and important note before we dive in. I'm not a doctor. I've done deep research on all of this, and I'll always flag when something needs a real medical consultation because some of these do. This is information to help you understand your own body better and have smarter conversations with your GP, not a replacement for professional advice. We clear on that? Great. Let's get into it. And if you've been dealing with this for more than 3 months, drop a comment below right now with how long. I genuinely want to know how many of you have been suffering in silence with this. The number might surprise both of us. So first, what exactly are we talking about? Chronic throat mucus. Doctors sometimes call it chronic pharyngeal mucus, or refer to the sensation as globus. But what it really means is that persistent feeling of phlegm, slime, or something stuck at the back of your throat, almost every day, for weeks or months at a time. You're constantly feeling the urge to clear it. Sometimes you do, and it comes back immediately. Sometimes you clear it and nothing actually comes up, but the feeling stays. Now here's something important that most people don't realize, and this actually matters for figuring out what's causing it. There are really 3 different things going on when people describe this problem. The first is actual excess mucus production. Your body is genuinely making too much. The second is mucus that's too thick and sticky to clear. Normally maybe you're not making more of it. It's just not moving the way it should. And the third, and this one surprises people, is the sensation of mucus when there isn't actually that much there. Your throat is sending signals to your brain saying something is stuck, even when physically there isn't much to clear. All 3 feel very similar from the inside, but the causes and the solutions can be quite different. Now, why does this hit the 40-plus crowd especially hard? Stay with me, because what comes next changes everything about how you think about this. As we get older, a few things shift. Our immune systems change and we can develop new sensitivities we didn't have at 30. Our digestive systems slow down and reflux becomes more common. Medications become more common in our lives. And for those of us in Northern and Central Europe, the heating systems we rely on for half the year are absolutely brutal on the airways. We'll come back to all of that. The agitating truth is this. This condition affects your life in ways that are out of proportion to how serious it sounds. It affects your voice. You sound hoarse. You sound like you're constantly sick. It affects your sleep. You wake up in the night needing to clear your throat. It affects your confidence at work, in meetings, on dates, at dinner parties. You feel self-conscious every time you're in a quiet room. And the absolute worst part? Most people just live with it for years because they think there's nothing to do about it. There is absolutely something to do about it, but you have to identify the right cause first. And that's exactly what we're doing today. All right, here's your roadmap for this video so you know what's coming. I'm going to take you through 6 organized groups of causes. Group 1 is upper airway, causes your nose, sinuses, nasal passages. Group 2 is digestive and reflux causes, and this one surprises most people. Group 3 is environmental and lifestyle causes, where you live, how you live. Group 4 is medication-related causes, and I promise you, This section is going to make some of you go, "Oh my God, that's it." Group 5 covers systemic medical conditions, and Group 6 covers the rarer but more serious causes you should be aware of. I'll tell you which causes are super common, which ones people always miss, and which ones genuinely need a doctor's appointment not next month, but soon. You might want to grab a pen or use the chapter markers in the description to jump around if you've already watched parts of this before. And genuinely, if you've been dealing with this for over 3 months, drop that comment. How long have you been suffering in silence? All right, let's get into Group 1. Upper airway causes. These are causes 1 through 4. Cause number 1, post-nasal drip. And I'm starting here because this is hands down the most common cause of chronic throat mucus in adults. Full stop. Here's what's happening. Your sinuses produce mucus all the time. That's completely normal. Mucus is actually your friend. It traps bacteria, viruses, dust, keeps everything lubricated. But normally it drains forward and out through the nose, or you swallow it without even noticing. With postnasal drip, excess mucus starts draining backward down the back of the throat instead, and you feel it constantly. What causes this excess production? Cold air, dry air, infections like colds or sinus infections, and big one, allergies. The symptoms that tend to confirm postnasal drip specifically are a runny nose alongside the throat feeling, symptoms that are worse in the morning when you've been lying flat all night and the mucus has pooled, and symptoms that improve in certain environments and worsen in others. Now here's why this is especially relevant if you're in Northern or Central Europe. Think about it, when was the last time you checked your indoor air quality in winter? Central heating systems in Germany, the Netherlands, the UK, Belgium, Scandinavia, they make indoor air incredibly dry. We're talking humidity levels that drop to 15 or 20% in a heated apartment in January. That dries out your nasal lining, which then cranks up mucus production to compensate. Then the mucus gets thick because there's no moisture, and it drips down your throat. It's a vicious cycle. Practical steps for postnasal drip. A saline nasal rinse, a neti pot or a saline spray used daily can dramatically reduce the mucus load. A bedroom humidifier set to keep humidity between 40 and 60%, especially during the heating season. And start paying attention to whether your symptoms are better or worse in certain rooms, outside versus inside, different seasons. That pattern is your clue. Cause number 2, allergic rhinitis. Now, this is related to postnasal drip, but it deserves its own mention because it works differently and needs a different solution. Allergic rhinitis, what most people call hay fever, is your immune system overreacting to something in the environment. Pollen, dust mites, pet dander, mold spores. Your immune system sees these harmless particles and treats them like an invasion. The response includes, you guessed it, excess mucus production throughout the upper airway. The chronic, year-round form of allergic rhinitis is extremely common in adults over 40. And here's something that genuinely catches people off guard. Many Europeans develop brand new adult-onset allergies after 40, even if they had zero allergies their entire childhood and 20s. Your immune system changes as you age, and it can suddenly start reacting to things it previously ignored completely. Dust mites are the big one for year-round symptoms because they live in your bedding, your carpets, your sofa. They're there every single night. Signs that allergies are your issue: itchy or watery eyes alongside the throat mucus, sneezing, symptoms that follow a seasonal pattern or are consistently worse in certain places. If you suspect this, seeing an allergist is genuinely worth it. Allergy testing is available across Europe and will tell you exactly what you're reacting to. Immunotherapy, allergy shots, or sublingual drops can actually reduce or eliminate the allergy response over time. It's not just about popping antihistamines forever. Cause number 3, sinusitis, acute and chronic. Now, here's where it gets interesting, because sinusitis is one of those things that people tend to think is just a temporary infection. You get it, you take some antibiotics, it goes away. Acute sinusitis, yes, that's often how it works. But chronic sinusitis, defined as sinus inflammation lasting more than 12 weeks, is massively underdiagnosed, and it is a very real and persistent cause of throat mucus. When the lining of your sinuses is chronically inflamed, it produces thick, sticky mucus continuously. That mucus accumulates, it doesn't drain properly, and a significant amount of it ends up dripping down into your throat. The key symptoms that differentiate sinusitis from other causes are facial pressure or pain, especially around the cheeks, forehead, and between the eyes, a reduced or altered sense of smell, and discolored mucus, meaning yellow or green rather than clear. Important note for those of you in Europe dealing with the healthcare system, many GPs tend to manage sinusitis conservatively and may not refer early enough. If you've had symptoms for more than 3 months, you're within your rights to ask specifically for a referral to an ENT, an ear, nose, and throat specialist. They can look directly at your sinuses, potentially using a nasal endoscope, and actually see what's going on. Don't just keep taking over-the-counter decongestants indefinitely and hoping it resolves. Cause number 4. Nasal polyps. Less common than the first 3, but important enough to include and important enough to know about. Nasal polyps are soft, painless, non-cancerous growths that develop in the lining of the nasal passages or sinuses. They're often described as looking like small grapes. The reason they matter for throat mucus is that they physically block normal mucus drainage, so mucus that should drain forward gets rerouted down the back of the throat. Nasal polyps often develop alongside chronic sinusitis or alongside allergies, so they tend to occur in people who already have some of those other issues going on. The key red flag that makes nasal polyps a real possibility, and this is important, is a reduced or absent sense of smell. If your ability to smell things has gradually decreased over time alongside your throat mucus symptoms, nasal polyps are a genuine candidate worth ruling out. The good news: nasal polyps are very treatable. Steroid nasal sprays can reduce them significantly. In some cases, a minor surgical procedure called a functional endoscopic sinus surgery (FES) is needed, but it's a relatively routine ENT procedure with a good success rate. The point is, don't let this one slide just because it's not painful. Okay, so those are your upper airway suspects, 4 causes, all coming from roughly the same area, but each with slightly different characteristics and different solutions. But that's not even the most shocking part, because the next group is one that most people completely overlook. And it might be the single most relevant group for adults in their 40s and 50s living European lifestyles. Let's talk about what's happening below the neck. Group 2, digestive and reflux causes. Causes 5, 6, and 7. Cause number 5, GERD, gastroesophageal reflux disease. I want to be really direct here. GERD is massive as a cause of chronic throat mucus, and it is dramatically under-recognized in this context. Most people know GERD as heartburn, but here's what most people don't know. You can have GERD that is significantly affecting your throat and producing constant mucus, and you can feel absolutely no heartburn whatsoever. None. This is actually pretty common. Here's what's happening physiologically. The lower esophageal sphincter, the valve between your stomach and your esophagus, relaxes when it shouldn't, allowing stomach acid to travel upward. When that acid reaches the throat, even in small amounts, the throat lining becomes irritated, and the body's protective response to that irritation is to produce mucus. More acid exposure, more mucus. It becomes a constant cycle. The symptoms that suggest GERD is behind your throat mucus. Symptoms that are noticeably worse after eating, especially large or rich meals. Symptoms that are worse when lying down or first thing in the morning. A slight hoarseness in your voice. Occasionally a sour or acidic taste at the back of your mouth or throat. And chronic throat clearing that never quite resolves anything. Now think about typical European adult lifestyle for a moment. Late dinners, it's culturally normal in France, Spain, Italy to eat at 9, 10 at night. Wine with dinner. Strong coffee. Rich, fatty food. Every single one of those is a known aggravator of GERD. I'm not saying change your entire lifestyle overnight, but understanding the connection matters. Practical steps. Elevate the head of your bed by about 15 to 20 centimeters, not just piling up pillows. Actually raising the bed frame or getting a wedge pillow so gravity works in your favor overnight. Don't eat within 3 hours of going to sleep. Reduce coffee, alcohol, fatty and fried foods, tomatoes, citrus, and speak to your GP about PPI medication, proton pump inhibitors, which reduce stomach acid production. They're effective and widely available. Cause number 6, LPR, laryngopharyngeal reflux, silent reflux. Now, I'm giving this its own entry because it is different enough from GERD that it genuinely deserves separate attention. And I'll tell you straight, this is probably the most underdiagnosed cause on this entire list. With standard GERD, acid is traveling up the esophagus and you might feel it as heartburn. With LPR, acid vapor, not even liquid acid, but acid vapor travels all the way up through the esophagus and reaches the larynx and the very back of the throat. The damage is subtle and slow, but the mucus response it triggers is constant and often severe. The defining characteristics of LPR, that separate it from standard reflux. Chronic throat clearing is usually the primary complaint, often the only complaint. A persistent feeling of a lump in the throat. Doctors call this globus sensation that never quite goes away. A hoarse voice, especially in the morning, that loosens up as the day progresses. And critically, no classic heartburn, no burning in the chest. People with LPR often feel fine from a digestive standpoint, which is exactly why it gets missed. Diagnosing LPR properly often requires a laryngoscopy, a camera examination of the larynx where an ENT can see the characteristic redness and swelling that acid vapor causes to the vocal cords and surrounding tissue. If you've had your symptoms attributed to everything else and nothing has helped, push for an ENT referral and specifically ask about LPR. Treatment is actually stricter than standard GERD management. The alginate-based medications like Gaviscon Advance specifically form a physical barrier on top of stomach contents and are often more effective for LPR than standard antacids. A low-acid diet trial, 2 to 4 weeks of strictly avoiding acidic, spicy, fatty foods, alcohol, coffee, carbonated drinks can serve as both a diagnostic test and a treatment start. If your symptoms improve significantly in that window, LPR was almost certainly contributing. Cause number 7, food sensitivities and intolerances. And I want to specifically call out 2, dairy and gluten. Dairy first because this is the big one that comes up time and time again. The mechanism here is important to understand because it's not the same as lactose intolerance, which is a digestive issue about breaking down lactose sugar. We're talking about casein, the protein in dairy products, which in some people triggers a noticeable increase in mucus production in the airways. It's not an allergy in the classic IgE sense. It's more of a sensitivity response, and the throat is often where you feel it most. How do you test this without a lab? Elimination. Remove all dairy milk, cheese, yogurt, butter, cream completely for 2 full weeks. Document your symptoms daily. If your throat mucus reduces noticeably, you've found a major contributor. Then reintroduce and see if it comes back. That's your answer. I know. Giving up cheese is basically a crime in France, in Germany, in the Netherlands, in Switzerland. I understand. But it might just change your life completely. And you might find that hard cheeses affect you less than soft cheeses, or that fermented dairy is fine while fresh dairy is the problem. The elimination trial gives you that nuance. Gluten sensitivity, even non-coeliac gluten sensitivity, can cause chronic low-grade inflammation throughout the body, including the airways and throat. If you've already tried the dairy elimination and not seen full improvement, a 2-week gluten-free trial is worth adding. And I'll mention alcohol here too because it fits in this group. Beer and wine in particular can trigger mucus overproduction directly. Relevant? I'd say so. For a European audience where wine with dinner is basically a birthright. Again, not telling you to stop, but understanding the mechanism lets you make informed choices. Now let's talk about the stuff in your environment, because where you live and how you live matters more than most people think. And if you're looking for answers that don't involve doctors or supplements, this section is for you. Group 3, environmental and lifestyle causes. Causes 8 through 11. Cause number 8, dry air and indoor heating. I mentioned this briefly earlier, but it gets its own entry because for anyone in Northern, Central, or Eastern Europe, this is genuinely one of the most impactful and most overlooked factors. From roughly October through April, central heating is running constantly. In modern heating systems, radiators, underfloor heating, forced air, they strip moisture from indoor air brutally efficiently. Indoor humidity levels in a well-heated Northern European apartment can drop to 15 or even 10% in midwinter. For context, the Sahara Desert averages around 25%. You're essentially living in conditions drier than a desert every night while you sleep. Your nasal lining and throat lining need moisture to function normally. When they dry out, 2 things happen. First, the mucus that's supposed to be thin and flowing becomes thick and sticky. It stops moving the way it should and it accumulates. Second, the body panics and produces more mucus to try to compensate for the dryness. So you end up with more mucus, and it's thicker. Classic situation. The solution is straightforward even if it requires a bit of investment. A bedroom humidifier, and ideally one with a hygrometer, so you can actually monitor your humidity level set to maintain 40 to 60%. That's the target range. You'll likely notice a difference within the first week of using it. Also, stay hydrated throughout the day and consider a saline nasal spray or saline throat spray to add direct moisture. If your throat mucus symptoms spike every October when the heating comes on, this is almost certainly a major contributor for you. Cause number 9. Air pollution and urban environment. This is relevant for anyone living in major European cities. London, Paris, Brussels, Amsterdam, Munich, Milan, Warsaw. Particulate matter, tiny particles from traffic, industry, construction, and chemical air pollutants irritate the airways chronically. Nitrogen dioxide from diesel exhaust is particularly nasty for the respiratory lining. And what does irritated respiratory lining do? It produces mucus. This is a background cause that's hard to feel directly, but it amplifies everything else. If you already have a mild sensitivity or mild reflux, chronic low-level pollution exposure turns it from a minor inconvenience into a persistent daily problem. You can't eliminate urban air pollution, obviously, but you can manage your exposure. An air purifier with a true HEPA filter at home makes a real difference. Keeping windows closed on high-traffic days or high-pollution days, most European cities now have air quality indexes you can check online. And doing a nasal saline rinse when you come in from being outside for extended periods. Cause number 10. Smoking active and passive. Tobacco smoke is one of the most potent direct irritants to the mucous membranes of the entire airway. The mechanism is simple. Smoke particles and chemicals come into contact with the delicate lining of the nose, throat, larynx, and airways. The body produces mucus as a constant protective response. And as long as smoking continues, the irritation continues, and so does the mucus production. The European smoking rates deserve a mention here because they remain significantly higher than North American averages, particularly in Southern and Eastern Europe. France, Spain, Greece, Czech Republic, Hungary smoking is still part of daily life for a substantial portion of the adult population. And for passive smoking, if a partner smokes in your home, you are not protected just because you're not the one holding the cigarette. Secondhand smoke exposure produces the same mucosal irritation, just at a slightly lower intensity. I'm not here to lecture you. Genuinely. You know smoking isn't great for you. But I'd be doing you a real disservice if I listed this at number 10 on the list and didn't say clearly if you're a smoker and you're dealing with chronic throat mucus, this is almost certainly a primary cause. And it's probably the single most impactful change you could make. Whatever support you need to do it, it's worth pursuing. Cause number 11. Dehydration and diet. Think about it, mucus is mostly water. When you're even mildly chronically dehydrated, mucus doesn't stay thin and flowing. It thickens. It gets sticky. It accumulates in the throat instead of draining normally. And we don't just mean severe dehydration. The average person walking around on a regular day in a heated office, drinking mostly coffee, is probably mildly dehydrated more often than they realize. In Europe, coffee culture is strong, and that's putting it mildly. Italians, Portuguese, Finns, Austrians, Dutch coffee is a daily ritual for most adults. Caffeine is a diuretic. Alcohol is a diuretic. If your daily fluid intake is heavy on coffee and wine and light on plain water, your mucus is thicker than it needs to be. The practical target is 1.5 to 2 liters of actual water daily. Not coffee, not beer, not sparkling wine water. Warm water and herbal teas are particularly helpful because warmth actively helps thin mucus. Diet matters beyond just hydration. Processed foods and refined sugar drive systemic inflammation, including in the airways. Excess dairy, as we covered, can increase mucus production. On the positive side, ginger, turmeric, garlic, warm broths, and foods rich in antioxidants all have evidence behind them for reducing airway inflammation. Not magic bullets, but meaningful as part of a consistent approach. Now here's a section I know some of you will find a little uncomfortable because we're going to talk about medications you might be taking right now. And the reason this section matters is that medication-related throat mucus is incredibly common, completely reversible, and constantly overlooked. Group 4. Medication-related causes. Causes 12 and 13. Cause number 12. ACE inhibitors. This might be the most commonly missed cause on this entire list for the 40-plus demographic specifically. ACE inhibitors are a class of blood pressure medication. These are drugs with names ending in pril. Lisinopril, ramipril, enalapril, perindopril. They are among the most widely prescribed medications in Europe for hypertension and certain heart conditions. Millions of people across the UK, Germany, France, Italy, and the rest of Europe take one of these every single day. A well-documented side effect of ACE inhibitors is a chronic dry cough. You'll find it listed in every patient information leaflet. What is less well known, and this is the part that's relevant for us today, is that ACE inhibitors also commonly cause a persistent throat mucus sensation and a chronic throat-clearing reflex. The mechanism involves a substance called bradykinin, which the drug allows to accumulate and which irritates the airways. If you started a blood pressure medication around the same time that your throat problems began, this is almost certainly the connection. It's not a coincidence. The timing is the clue, and I'll tell you, once you see this pattern, you cannot unsee it. The solution is clear, and it's safe. Talk to your GP about switching from an ACE inhibitor to an ARB, an angiotensin receptor blocker. Drugs like losartan, candesartan, valsartan, they control blood pressure through a similar mechanism but without the bradykinin buildup, which means no cough and no throat mucus side effect. It's a well-established switch, and your GP should be very familiar with it. Do not stop your blood pressure medication on your own. I want to be very clear about this. Blood pressure medication is there for a reason, and stopping suddenly can be dangerous. Have the conversation with your doctor, explain the side effect, ask about alternatives. But do not just stop taking it. Cause number 13. Other medications that affect mucus. There are several other drug categories worth knowing about. Antihistamines, and this one is counterintuitive, especially the older, first-generation antihistamines like chlorphenamine or promethazine, can actually thicken mucus even though they're prescribed partly to reduce mucus production in allergies. They dry out secretions, which makes existing mucus stickier and harder to clear. If you're taking antihistamines for allergies and your throat mucus feels worse, switching to a second-generation antihistamine like cetirizine or loratadine might help. Inhaled corticosteroids, asthma, and COPD inhalers like fluticasone or budesonide can deposit residue in the throat and larynx, causing a coating sensation that increases the feeling of mucus. The fix is simple but often not communicated clearly enough. Always rinse your mouth and gargle with water after every single use of a steroid inhaler, every time. This removes the residue before it can cause problems. Certain antidepressants and antipsychotics cause dry mouth and throat as a side effect. When the throat is dry, it paradoxically triggers a compensatory mucus response as the body tries to protect the dry tissue. If you're on these medications, stay very well hydrated and speak to your prescriber if the throat symptoms are significantly affecting your quality of life. And for women over 40, specifically hormone therapy, whether for perimenopause or menopause, involves hormonal shifts that directly affect mucus production throughout the body. The mucous membranes of the nose and throat are hormone-sensitive tissue. As estrogen levels fluctuate or decline, mucus quality and quantity in the throat can change noticeably. This is a real, physiological cause that deserves acknowledgement and discussion with your gynecologist or GP. Okay, we've covered the common stuff, the stuff that accounts for the majority of cases. Now I want to go through conditions that are a bit less common but important enough that you need to know about them. Some of these need medical attention. Pay close attention. Group 5, systemic and medical conditions. Causes 14 through 17. Cause number 14, hypothyroidism. Underactive thyroid. The thyroid gland sits right in the front of the neck, wrapped around the windpipe. When it's underactive, when it's not producing enough thyroid hormone, it can cause swelling and a feeling of fullness or pressure in the throat area. It also affects the body's overall metabolism and inflammatory state, which can alter mucus production and quality. What makes hypothyroidism particularly important to flag is how common it is in women over 40, and how often it goes undiagnosed because the symptoms are vague and easy to attribute to other things. You might feel constantly tired. You might have put on some weight without obvious reason. You might feel cold when other people around you feel fine. Dry skin, brain fog, constipation, and yes, throat symptoms, including a mucus sensation. Here's the thing. If you have 3 or more of those alongside the throat mucus, it's worth asking your GP for a TSH blood test, thyroid stimulating hormone. It's a routine, inexpensive blood test that gives a clear answer. And if your thyroid is underactive, treatment with levothyroxine is simple and effective and will address all of those symptoms together. It's a test that gets missed more often than it should, particularly in women who are told their symptoms are just stress or hormones. Cause number 15, asthma, especially cough variant asthma. Most people carry a very specific image of asthma, someone wheezing, struggling to breathe, reaching for an inhaler. And yes, that's one presentation. But cough variant asthma presents very differently. The primary symptom is a chronic cough and throat mucus, often with no wheeze at all. No shortness of breath. No classic asthma attack. Just a persistent cough and that mucus feeling. Adult-onset asthma, developing asthma after 40 for the first time, is more common than people realize. It's often triggered by cold air, exercise, strong chemical smells, or respiratory infections that seem to leave a lasting cough behind. And if you're not connecting those triggers to the possibility of asthma, you might spend years treating symptoms rather than the underlying condition. Cough variant asthma can be confirmed with a spirometry test, a simple breathing test that measures airflow along with bronchodilator challenge testing. Ask your GP if this has been ruled out, particularly if your symptoms worsen in cold weather or after exercise. Treatment with an appropriate inhaler is usually very effective. Cause number 16. Autoimmune conditions. Sjögren's syndrome, lupus, and others. Sjögren's syndrome is primarily known for attacking the moisture-producing glands, causing dry eyes and dry mouth as its signature symptoms. But the impact on mucus quality throughout the body is more complex. In the throat, Sjögren's can paradoxically create both a dryness sensation and a thick, uncomfortable mucus feeling simultaneously. The mucus is there, but it's abnormal, too thick, too sticky, not functioning the way it should. Sjögren's is significantly more common in women and tends to be diagnosed in the 40s and 50s, which makes it relevant for a meaningful portion of our audience. And as with many autoimmune conditions, it can be present for years before being diagnosed because the symptoms seem unrelated. Other autoimmune conditions, including lupus and rheumatoid arthritis, cause chronic systemic inflammation that can affect the airway and throat lining. If you have joint pain, particularly in the mornings, particularly in smaller joints alongside dry eyes, fatigue, and chronic throat mucus, an autoimmune workup with a rheumatologist is worth pursuing. Ask your GP for a referral. Blood tests for ANA, anti-Ro, and anti-La antibodies can give strong signals toward or away from Sjögren's. Cause number 17. Vocal cord dysfunction and globus sensation. This is a fascinating one, and it gets overlooked far too often, partly because it's harder to see on a scan or a blood test. Globus pharyngeus is the medical term for the sensation of a lump or something stuck in the throat when there physically isn't much there. It's real. It's not imaginary or psychological in the dismissive sense of that word. It's a genuine neuromuscular phenomenon where the throat muscles are in a state of heightened tension, creating a persistent sensation of something being present. Common triggers include chronic stress, and the muscles of the throat are surprisingly responsive to psychological stress reflux that has caused the throat to become hypersensitive and habitual throat clearing. And here's the cruel irony that you should know. Every time you clear your throat trying to get rid of that feeling, you're actually making it worse. The act of throat clearing is quite forceful, and it irritates and inflames the delicate tissue of the throat, which then sends more signals to the brain saying something is there, which makes you want to clear your throat again. It's a perfect self-reinforcing loop. Treatment for globus sensation is highly effective when it's properly addressed. Speech and language therapy, specifically voice therapy techniques that teach you to reduce throat tension, works very well. Stress management and addressing underlying anxiety helps. And replacing the throat-clearing reflex with a small sip of water is one of the most practical habit changes you can make immediately. A sip of water lubricates the throat, swallowing resets the muscle tension, and unlike throat clearing, it doesn't cause additional irritation. And finally, I want to briefly cover a few rarer but more serious causes. I'm not saying this to scare you, I'm genuinely not. But if any of these apply to your situation, knowing about them matters. Group 6. Serious and red flag causes. Causes 18 through 20. Cause number 18. Chronic bronchitis and COPD, chronic obstructive pulmonary disease. This is particularly relevant for current or ex-smokers over 40, though it can occur in non-smokers too, particularly those with a history of significant pollution or occupational dust exposure. Chronic bronchitis means the bronchial tubes, the airways leading to the lungs, are in a constant state of inflammation. The body produces excess mucus continuously to try to deal with that inflammation, and a significant amount of that mucus travels up and is felt in the throat. The key distinguishing feature here is that the mucus is productive, meaning you can actually cough things up, not just feel the sensation of something there. Shortness of breath on exertion is usually present. Symptoms tend to be worse in cold, damp weather relevant for northern and western European climates for a good portion of the year. If you're a smoker or an ex-smoker over 45 and you haven't had a spirometry test, a basic lung function test, ask your GP to arrange one. COPD is significantly undertreated partly because it's underdiagnosed. Early identification and management makes a real difference to long-term lung health. Cause number 19. Esophageal issues including Zenker's diverticulum. This is a less common one but worth knowing about, particularly for those in their late 50s and beyond. A Zenker's diverticulum is a small pouch that can form in the wall of the esophagus, typically just where the throat meets the top of the esophagus. Food particles, liquid, and mucus can collect in this pouch and then periodically regurgitate back upward, creating a persistent mucus and throat sensation. The distinguishing signs that make this worth investigating: regurgitating small amounts of undigested food, sometimes hours after eating, unexplained bad breath alongside the throat mucus, a gurgling or bubbling sound from the throat, particularly when swallowing. If those features sound familiar, this needs imaging to diagnose. A barium swallow study is the standard test. It's treatable when identified. Cause number 20. Addressing the possibility of cancer honestly. Because I know some of you have Googled your symptoms at 2 in the morning and cancer came up in the search results. And I think refusing to mention it would do you a disservice. So let's talk about it directly. Throat cancer, laryngeal cancer, and esophageal cancer can present with chronic throat symptoms. That is true. However, and this is important, they almost always come with other signs beyond just the throat mucus. Unexplained significant weight loss, difficulty swallowing food or liquid, feeling like it's getting stuck, persistent hoarseness that doesn't improve, a lump you can feel in the neck, blood in your mucus or phlegm. These are the red flag symptoms. If you have chronic throat mucus as your only symptom, with none of those other signs, cancer is a very unlikely cause. The vast majority of cases of chronic throat mucus come from the far more common causes we've spent the last 30 minutes going through. But, and I want to be clear, if you have 2 or more of those red flag symptoms alongside the mucus, please see a doctor this week. Not next month, not when you get around to it. This week, early detection genuinely saves lives, and a GP appointment is the right first step. Okay, we've been through all 20 causes. Now let's bring this together with a practical action plan, because information without action doesn't help anyone. Here is your Start Here framework. 6 steps. Step 1. Identify your most likely group. Ask yourself a series of simple questions. Is the mucus mainly related to your nose and sinuses, runny nose alongside it? Worse in certain environments? Worse seasonally? That points to group 1. Is it mainly after eating? Worse lying down? Worse in the morning before you've moved around? That's group 2. Did it start when you started a new medication, particularly blood pressure medication? That's group 4. Narrowing down to the right group first saves you a lot of time and trial and error. Step 2. The 2-week dairy elimination test. This is the cheapest, easiest, zero-risk first experiment, and it catches a surprisingly large number of cases. Remove all dairy, every form of it, completely for 14 days. Keep a simple daily log of your throat mucus severity on a scale of 1 to 10. At the end of 2 weeks, compare your average score to your starting point. A reduction of 30% or more strongly suggests dairy sensitivity is a contributor. Then reintroduce dairy and see if symptoms return. That's your definitive answer. Step 3. Check your medications. Sit down with the patient information leaflets or look up each medication you take online and specifically check whether chronic cough, throat clearing, or mucus is listed as a side effect. If it is, particularly for any blood pressure medication, make an appointment with your GP to discuss alternatives. Don't stop medication yourself. Just have the conversation. Step 4. Optimize your environment. Humidifier on during the heating season, targeting 40 to 60% indoor humidity. Air purifier with a HEPA filter if you're in an urban environment. 2 liters of water minimum daily, actual water, not just coffee. Nasal saline rinse if you're in a dry environment or heavily polluted area. Step 5. The reflux trial. If you eat late dinners, drink wine regularly, have coffee, and your symptoms are worse in the mornings, try 2 full weeks of eating your last meal before 7 p.m., no alcohol, no coffee, elevated head during sleep, and an alginate antacid like Gaviscon Advance taken after your evening meal and before bed. Keep a log. If symptoms improve meaningfully, GERD or LPR was almost certainly a significant contributor. Step 6. See a doctor if any of the following apply. It has been more than 3 months with no improvement despite your own trials. You've identified one or more red flag symptoms. You suspect chronic sinusitis, nasal polyps, or asthma that hasn't been investigated. You want to rule out hypothyroidism with a simple blood test. Or you want a formal assessment for LPR or Sjogren's syndrome. Now let me give you the specific action protocol for the most actionable supplement support in this area, because this is something a lot of people ask about. If reflux and inflammation are your primary suspected causes, here's what the research supports. N-acetylcysteine NAC at 600 milligrams per day taken with your largest meal helps thin mucus secretions and has genuine mucolytic evidence behind it. Use the standard pharmaceutical form available at pharmacies. Take it for a minimum of 6 weeks to assess effect. Do not use NAC if you have asthma without discussing with your doctor first, as it can occasionally trigger bronchospasm. If you take blood thinners or nitroglycerin, also check with your GP. For reflux support, alginate-based treatment Gaviscon Advanced specifically, not standard Gaviscon taken at 10 milliliters after meals and before bed. Use for 2 to 4 weeks as both a diagnostic trial and treatment. This is appropriate for most adults, but check with your pharmacist if you're on other medications. For inflammation reduction, a combination of standardized ginger extract at 250 milligrams twice daily with food and quercetin at 500 milligrams once daily with your main meal has a reasonable evidence base for reducing airway inflammation. Minimum 6 weeks to assess. Avoid quercetin if you're on antibiotics or chemotherapy agents without medical advice. Timeline reality check. If post-nasal drip from dry air is your issue and you start using a humidifier tonight, you might notice improvement within 3 to 5 days. If dairy sensitivity is your cause and you start the elimination diet today, 2 weeks gives you a clear answer. If reflux is your cause and you start the dietary and positional changes together with alginate therapy, most people see meaningful improvement within 2 to 4 weeks. If you need a medication switch from an ACE inhibitor, the cough and mucus typically resolve within 4 to 6 weeks of stopping the offending drug. I know that list felt long. Genuinely, 20 causes is a lot to process. But knowledge is power here. The real difference between someone who suffers with this for 10 years and someone who solves it in 3 weeks is almost always just knowing which cause is theirs. And now you know all 20. If you made it this far genuinely, well done. This was a lot of information, and the fact that you stayed through the whole thing tells me you're serious about understanding your health. That's exactly what this channel is for. Quick recap of the 6 groups. Upper airway causes including post-nasal drip, allergic rhinitis, sinusitis, and nasal polyps. Digestive and reflux causes including GERD, LPR, and food sensitivities. Environmental and lifestyle causes including dry air, pollution, smoking, and dehydration. Medication-related causes including ACE inhibitors and other drug side effects. Systemic conditions including hypothyroidism, asthma, autoimmune conditions, and vocal cord dysfunction. And serious red flag causes including COPD, esophageal issues, and the red flag signs that warrant urgent attention. Drop a comment below. Which cause do you think is most likely for you? I read every single comment and I reply as often as I can. It genuinely helps to know your situation. If this video helped you, share it with someone you know who's always clearing their throat. They might not know why it's happening, and this video might be the thing that finally gives them an answer. That kind of share means more than you know. We publish new senior health content every week, real information, no fluff, no scaremongering. If you haven't subscribed yet, hit the subscribe button and the bell notification so you don't miss the next one. And if this video sparked a suspicion about reflux or silent LPR for you specifically, our deep dive video on GERD and silent reflux goes into much more clinical detail. And if the thyroid section caught your attention, our video on thyroid symptoms over 40 that people are missing is worth watching next. Both are linked right now. See you in the next one.